Albuterol, commonly known by the brand name Ventolin, is a bronchodilator used to treat or prevent bronchospasm in people with reversible obstructive airway disease. It is commonly prescribed for conditions such as asthma and chronic obstructive pulmonary disease. Albuterol is also known by other brand names Airomir, Air Supra, Combivent, ProAir, and Proventil. Common side effects of albuterol may include headache, nervousness or shakiness, throat or nasal irritation, and muscle aches. Severe side effects can include chest pain, irregular heartbeats, severe headache, dizziness, fainting, worsening trouble breathing, and allergic reactions such as rash, itching, and swelling. Albuterol is a selective beta-2 adrenergic agonist. It works by stimulating beta-2 adrenergic receptors in the smooth muscle of the airways. This leads to the activation of adenylate cyclase, which converts ATP to cyclic AMP. Increased cyclic AMP levels cause relaxation of bronchial smooth muscle and inhibition of the release of immediate hypersensitivity mediators from cells, especially mast cells. Albuterol dosage can vary depending on the patient's age, condition, and response to treatment. For asthma or COPD, typically 2 puffs every 4 to 6 hours as needed, or 2.5 milligrams administered 3 to 4 times a day by nebulization. For exercise-induced bronchospasm, 2 puffs is taken 15 to 30 minutes before exercise. It is important to follow the prescribed dosage and not to exceed the recommended amount. Albuterol can interact with other medications, which may affect how it works or increase the risk of serious side effects. Beta blockers can reduce the effectiveness of albuterol. With diuretics, there is increased risk of hypokalemia or low potassium levels. Albuterol may affect heart rhythm and digoxin levels. Monoamine oxidase inhibitors and tricyclic antidepressants may increase cardiovascular side effects. There are several warnings to consider. When using albuterol may cause significant cardiovascular effects, including increases in heart rate and blood pressure. Caution is advised in patients with cardiovascular disorders. Paradoxical bronchospasm can occur with the use of albuterol, leading to worsening symptoms. If this happens, discontinue use immediately and seek medical attention. Allergic reactions such as rash, swelling, and anaphylaxis can occur. In pregnancy and breastfeeding, consult a healthcare provider, as it should be used only if the potential benefit justifies the potential risk to the fetus or infant. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative health content. Stay tuned for our next video.